Good morning, folks. It is
Good morning.
10:01. We'll give it until about 10:05 and then get started. Thank you all for being here today. Kenan. Oh, okay, I can see the waiting room too. I was just gonna say if it slows down significantly, we can get started a little bit before 10:05, but just want to give folks time to come in.
Oh, no, we're fine. No rush. Oh, yes.
All right, folks. It is now 10:03. It looks like our waiting room is slowing down a little bit. So I'm gonna go ahead and kind of give us a slow roll to get started here, just out of respect for folks' time. Um, Good morning. I'm so excited all of you are here. Just real quick, if we could go around and do some introductions. I'll start. My name is Liam Hudson. I have the honor of being the chair of the Southside Wellness Coalition, and I'm the co-founder of the Lean In Project. And so I will popcorn it to Alex. You were the first on my screen.
Perfect. Hi, everyone. I'm Alex Adler. I'm the Virginia Partnership Manager for Groups Together. We are an outpatient medical assisted therapy for opiate use disorder. First time here, so I'm excited to be here and learn about what the coalition is doing. Other than that, I think I see Sherry next, so I'll pass it over to Sherry.
Hi, I'm Sherry Elena Martin. I am the housing case manager here at Tri-County. I'm also on the leadership for the Southside Wellness Coalition, and I will send it to Catherine.
I think Catherine is in transit, so she may not be able to come off mute.
I thought I was off of mute, guys, but this is Catherine. I'm the Chief Financial Officer and Development Officer at Tri-County Community Action Agency, past person on the leadership team. Happy to be here, and I am in transit, so I'm going to put myself on mute again. And I cannot see anybody, so Liam, will you help me out and pick somebody for me?
Sure. Camilla Warren, is that did I say that correctly?
Real close, Kamala, just like Pamela
Camilla.
with the
Good
C,
morning.
Kamala
Thank you.
Warren. Good morning, everyone. This is my first time being a part of this group. I am in the process of some training to become a community health worker. And one of the things that we are asked to do is to go ahead and start getting involved in the community and the different activities that are out there to help people. And so I'm just sitting in to find out more about the resources in Mecklenburg County and all the groups that are participating today. So I'm just going to be listening in, trying to figure out how I can fit in. I do need to get some volunteer hours in. So if you need some help, please let me know. And I
Great. Thank
guess
you so much.
who should I be giving it to? Let's see, Elizabeth?
Yes, I'm Elizabeth Kopp with Girl Scouts of Virginia Skyline. And just a little preference, we serve Halifax. That's the only county that I think your coalition serves that we also serve. We have a large footprint, but sometimes just a small area of it overlaps with your coalition in this context, as I said. So don't really know about some of the other areas you serve, but it's always interesting to hear other places in Virginia.
Very great. Thank you for being here. And then Ashley.
Hope you can hear me. Okay. My name is Ashley Benegas. Good. I am from UVA Cancer Center. I'm an outreach specialist here in Danville. This is my first time in this meeting, so thank you for having me. We work a lot in this catchment area. Our main office is in Charlottesville, Virginia, but in my catchment area, I work with Danville, Halifax, Martinsville area, but I haven't been able to be in the South Side yet. So this is my way of kind of reaching out and learning more about what you guys do. So excited to be here.
Great. Thank you for joining us. Allison, can I pass it to you?
Yeah, sure. Hi, everybody. I'm Allison Byrne. I am the Community Engagement and Partnerships Coordinator at the Central Virginia VA Medical Center. So I work with community coalitions, and I cover most of Central Virginia and Southside. Forgot to pass it. Sharonda?
And if anyone is having trouble coming off mute, feel free to utilize the chat for introductions as well. I apologize, I meant to say that earlier, but oh no, technical difficulties. Well, that's all right. Oh, there we go. I see you're off mute now, Miss Sharonda. Okay.
Got Carla is next.
Okay. Yeah.
Thomas from Health Quality Innovators. We support numerous community coalitions focused on health and wellness across the state of Virginia, and we've been glad to support your efforts over the years. We're focusing on topics like opioids, care transitions, chronic conditions, and vaccine promotion. So glad to be here. Is it Kamala or Kamala? I'm sorry, I didn't get the way to pronounce your name, but glad to hear you're studying to be a CHW. I'm going to put information about a webinar that we are hosting next week that features 3 CHWs working across the state to address social drivers of health.
Great, thank you. I appreciate that. It's Kamala, but if you want to say Cam, whatever is easy.
Thanks.
Thank you.
And then Kenan, I think that leaves you.
My name is Kenan Tyner-Smith. I am the Prevention Director for Southside Behavioral Health and Fiscal Agent for the Southside Wellness Coalition. I'm a member of the leadership team. Glad everyone could join us this summer afternoon, or summer morning, actually. I've been here so long now, it feels like afternoon. Sorry about that.
And I'm assuming there's no one in the room, or did I miss someone, Kenan?
Surprise! No, there's no one in the room, and yeah, and I have my cake here this morning and snacks. And so next time y'all need to come and join me because I have a cake, I have some water, some Sprites, some Mountain Dew, some Rice Krispie treats, some cereal bars. Yeah, I'm lonely today. This is very unusual. I'm sure it's because of the nice weather outside.
Everybody's on vacation.
That too, absolutely, absolutely. Yeah, Carla can join me anytime.
I will. I need to. I
Yeah.
need to one of these days.
And for those that don't know, Kenan makes a mean coalition pound cake. So it's worth the trip to SBH just for the pound cake.
Yeah, I think everybody in the front office has been discussing who's going to take slices home. Because Nina came in here, she's like, I don't think it's come in for you this morning. I was like, no, not yet. She's like, okay, I see you have cake. Yes, I have cake. Coalition
Well.
cake.
Well, thank you all for being here this morning. I know, a lot of folks are on vacation or out and about, so I appreciate y'all taking the time to be here. Real quick before we hop into the presentation for today, most of y'all should have gotten last meeting, May 23rd, some minutes via email. Well, I don't know most of y'all because y'all are new, but for the folks who have attended before, you should have gotten last month's notes via email. Just wanted to ask really quickly, any questions, thoughts, comments, concerns on our May 23rd meeting? Hearing no thoughts, comments, or concerns, may I call for a motion to approve?
This is Catherine. I'll motion to approve the May minutes.
I'll second. This is Elena.
All right, great. Thank you. Hearing a motion to approve in a second, the minutes from May 23rd are officially approved. Thank y'all. And thank you, Sharonda, for putting your information in the chat.
Thank you.
All right. Well, so you guys get to hear a lot of me chatting today because I am today's presenter. I'll go ahead and share my screen so that we can. So hi folks, again, my name is Liam Hudson. In addition to being the proud chair of the Southside Wellness Coalition, I'm also the founder of an organization called the Lean In Project. We'll get a little bit into what that is in a second here, but also just wanted to call out in case folks didn't know, June is officially Pride Month. So for folks in the LGBTQIA plus community, it is a month of recognition, of our elders and recognition of how far we've come, but also just pride and rejuvenation to continue the movement that we need to work and strive towards today. So just real quick, in case folks don't know, I know that acronym can be a little bit intimidating. So L, lesbian, G, gay, B, bisexual, T, transgender, Q, queer or questioning. I is intersex, and then A usually stands for asexual. And then the plus encompasses two-spirit individuals, which is a special designation within the LGBTQ community, specifically for indigenous and native identifying folks. And we also, just try to be all encompassing with the umbrella. So again, I know that acronym is a bit of can be a little bit to tackle for folks who aren't familiar. Do recommend that you check out our website. We have tons of great resources on there, including a glossary of important terms. And you can find that at leaninproject.org. So that's a little bit of background on what we're here and or why we're here, and what today's presentation is going to be about. So a little bit about us. We were founded in 2020. We were officially incorporated in 2021 as the only crisis services provider for LGBTQIA plus folks in Southside Virginia. So like I said, we are now a nonprofit, but we do almost exclusively mutual aid-based crisis services. And we do this so that our crisis services are 100% barrier-free. And so what I mean by that is if folks identify in the community and they're in crisis, we help them with what they need, whether it be a stipend to help them pay rent or a hotel room for the evening, medical services. We've paid for therapy appointments, things like that before. Really anything the person may need to get them out of their crisis situation. We also, on the flip side of that, provide training, consulting, and capacity building for community partners and nonprofits in the Southside area. We've had the pleasure now of working with Southside Behavioral Health a couple of times. We're also working with Kaleidoscope and other groups in the region. We've worked with Tri-County Community Action Agency a couple of times. So it's always a real privilege. It's something that I really enjoy being from the Southside community myself. Is just being able to give back in this way and see folks learn and grow in a new way. And what you'll see here is on the left here, the picture is our harm reduction kit. We give these out at almost all events that we attend, and they're just helping to address some of the disproportionate and disparities that LGBTQ folks face in our region. So our goals are really to create and sustain a community crisis response system. We also want to provide education and training and form and sustain a collaborative community response to equity building. We really value equity and empowerment, authenticity and transparency and innovation and growth. And we do this by constantly seeking community feedback and input. We also do this through everyone who receives crisis services through us is asked to complete a survey or provide a response. And that just helps us make sure that we are meeting the need of our community and that we continue to show up in the way folks need us to. So our team is small but mighty, if I do say so myself. It's comprised of Han Schweitzer, who is our co-founder and chief operating officer, and myself. I am the co-founder and chief executive officer. Together, we kind of do like a two-leg stool approach. Han does most of our capacity building and training oversight. They oversee a lot of our grants. And then I come in on the other side and I manage all of our crisis services. I manage the mutual aid part of Lean In. And just real quick, folks, if folks don't know what mutual aid is essentially community-based donations, but they are without restriction. It's most of the donations we receive are from folks in the LGBTQ community, but not always. And so we do this so that we don't have to accept barriers or restrictions in our intake and the services that we can provide. It does help a lot in being able to provide lots of comprehensive services. But also the downfall to that is it is donation based. So if we're not receiving donations, then we're not able to provide those services. And so this is a model that we've been building for the last 4 years now. We are able to provide, I would say, in 2023, we were able to assist 47 people with direct crisis service outreach. And then we are again have the training and capacity building side, which is a little bit more rigid in terms of funding. That side of our operations does come from grants or stipends or contracts that we have with our partners. So again, small but mighty, and we were born out of almost entirely out of community need, and have been operating that way ever since. And so why do we do what we do? Before I get into the stats on the slide, this is a photo that was taken in 2016 at the National Women's March in Washington, D.C. At the time, I wasn't even 30 years old, and the kid in the middle came up to me and hugged me and said that they'd never met somebody like them that was as old as I was, and that they didn't know that we lived to be that age, which was really, shocking to hear when you're in your late 20s. But also, it's not uncommon. I would say I openly identify as queer. If you're not in the LGBTQ community, I would not use that word. but I openly identify that way. And so, it's not uncommon for me to be the first person that someone has met who identifies the way that I do in our region. And so, I would say that that's often the experience, more often than not, the experience that I have when engaging with people in the community. And it's been it's been a learning experience for me. It's also been a humbling experience for me in a lot of ways. Um, but it's also been a really beautiful opportunity to come back to my hometown after feeling very ostracized and isolated for most of my childhood, to be able to stand in a new light and say, hey, no, we're here. We've always been here, and we're a big part of this community. And so that's really how we started and how we got started, why we continue to do what we do. So for those of you who are familiar, the American Civil Liberties Union, or the ACLU, is currently tracking 522 anti-LGBTQ bills in the US, 12 of which have been proposed in Virginia. Now, all 12 have been successfully defeated. Thank you in large part to groups like Equality Virginia for that. But still, 522 different pieces of legislation that restrict LGBTQs folks access to housing, education, healthcare, excuse me, and all kinds of stuff is really intimidating and really harmful to an entire collective of individuals who, for the most part, are just trying to live normal lives. And so we know that due to this extreme targeting and lack of affirmation and the removal of safe spaces, that folks in the community have much, much higher risks of homelessness. There are greater health disparities amongst folks in the LGBTQIA population. We see an increase in risk behaviors. So I've called out specifically self-harm and substance use, but it's also, sometimes risky online behavior, engaging with folks who may not be the safest. We see a lot of catfishing. We see a lot of targeting specifically of trans women, who are often victims of online catfishing, or folks trying to behave in predatory ways towards them. We also see folks in the community who have a significant decrease or a lack of social supports. And so that means, friend groups or mentorship groups, or family is a big one too, where folks may not have the support that others who are not in the community have access to. And so we show up, and we definitely are under no disillusion that we can provide all of the needs for folks, but we can be, and we are, an affirming space. A lot of times we are the first person, or we are the first place that people feel completely comfortable sharing the fullness of their identity and the fullness of their experiences. And we really try to take a holistic approach when we talk to folks. And so, they may come in and present and say, well, I need housing. But then through further assessment and just conversation, we're able to understand that, okay, they need housing because they have zero social supports. They also were fired from their job, very likely because of their identity. We also know that now they don't have a job, and so they probably can't sustain housing long term. And so we're able to come up with plans to get them out of that immediate crisis, but also start to meet some of those needs. And so that can look like getting them connected with affirming groups, getting them connected with sometimes group homes, if that's a viable option. We also can do things like we filed lots and lots of civil rights violation complaints for folks. We do a lot of medical advocacy for folks when they experience discrimination in a healthcare setting. And so we really try to not only provide the immediate crisis need, but also fix the long term, or provide a long term solution. And so I'm going to check the chat real quick. I see. Oh, okay. Thanks, Carla. All right. So that's a little bit about us and why we do what we do, how we got here. Next slide. There we go. So something I want to say is, I think there is often a stigma or bias that queer folks or LGBTQIA plus folks don't live in rural areas. But we're finding out that that's actually not the case. So a 2019 report showed that 3.8 million folks in the community live in rural America. And so that's a significant portion of folks who identify as LGBTQIA plus. You know, a lot of it is folks like myself who were born and raised in a rural area and really love you know what rural areas have to provide, but also, you know, especially with COVID-19 and cities just becoming less and less affordable, we see more and more folks kind of migrating to rural areas from other places as well. And so this is, you know, this is a significant uptrend that we've seen in probably the last 10 to 15 years. I would say if you looked at stats from the early to mid 2000s, it would not be the same. And so some of the contributing factors to that are, again, you know, the migration out of cities due to the lack of affordability, but also I think folks are just, you know, we're showing them our charm a little bit down here in the rural spaces. And so it's hard to deny the sense of community and the charm that small towns and rural places can offer. And so with this, we're also seeing we're seeing some influence towards communities becoming more open-minded and more welcoming to the LGBTQIA plus community. But we're also seeing, again, like I said, the ACLU is tracking 522 bills currently. A lot of that is, you know, folks not feeling super comfortable with some of the books in schools or some of the content being available. And so this is, again, contributing to that lack of safe spaces for LGBTQ folks, the lack of representation for LGBTQ folks. And so while we are seeing a higher number of folks moving to rural areas, we're also seeing a lot more pushback than we have in previous years. Gonna check the chat really quickly. Okay, cool. And so sorry, skip too far ahead. And so, you know, one of the things we like to call out, we can talk a lot about the disparities. We can talk a lot about the systemic targeting and disproportionality that is faced by LGBTQ folks in rural areas. But something that we don't talk about enough, in my opinion, is the resilience of this community, especially this community in smaller towns and in rural areas. So we know that LGBTQIA plus folks, especially those holding multiple or intersecting marginalized identities. So by this, we mean people of color, people with limited ability statuses, maybe people who are returning citizens or justice involved, anything that contributes to the systemic marginalization of their identity. And those intersecting identities are often faced with really harsh situations and environments, and often have to develop a great level of resilience in order to survive those environments. We know that rural areas can sometimes be more isolating and present unique challenges for LGBTQIA folks. This is, you know, due in part to a lack of exposure or knowledge throughout the community. We also see an increased spiritual or religious influence, which doesn't necessarily translate to homophobic or transphobic, but it has certainly been used that way in some communities and in some places. And then also we see, you know, a lot of stigma and group mindset. So it's kind of this mentality of, oh, well, so-and-so doesn't like gay folks. I don't like gay folks either. Or, you know, almost a fear mentality of the unknown of, okay, well, I don't understand what's going on, so I'm going to write that off as perverse and something that is scary to me. And so we see that a lot, again, just the smaller towns, everybody kind of knows everybody. You know, it's really hard to keep a secret in a small town. And so that all of that can kind of contribute to a little bit more of a harsher and isolating environment. And so we also know that the flip side of that folks who do live in rural areas, especially LGBT folks who are born and raised in rural areas, often identify just as heavily with being from that area as they do as being LGBTQIA plus. So when I say that, I mean that when folks are asked or asked to leave or are isolated out of their communities, that oftentimes it feels like a part of them has been taken away from them. I know for myself, when I turned 18, I got as as far out of Halifax County as I possibly could, as quickly as I possibly could. And for a long time, had a deep sense of longing and not really understanding where that came from. But then, as I've been able to heal some of that and come back to my community, understand that that's what I was really missing was that sense of familiar community, was the community that I grew up in and loved. And so, it's a big part of who folks are and how they integrate themselves into their environments. And so we know, again, like we said, sometimes being from a rural area can increase increase that need to develop resilience. But also due to this, we know the research is showing that LGBTQIA plus folks in rural areas have higher resilience indicators than their peers. And when I say peers, I mean cisgender heteronormative folks, so straight people, and also LGBTQIA plus folks living in urban settings. And so they did kind of a twofold study there of like the heteronormative straight folks in the rural area, but also LGBTQIA folks living in different environments. And they showed that rural LGBTQIA plus folks have some of the highest indicators of resiliency amongst amongst a lot of folks. And so we also know that the other side of that is that folks who have worked to develop those bits of resilience, folks that have worked through a lot of the traumas that have caused that resilience, often have a great impact on their community. We see, folks wanting to come back to their community and give back in a way so that other folks maybe don't experience similar hardships as they experienced. We see LGBTQIA folks doing a lot of emotional labor to educate their families and their community members, and in some instances, their spiritual supports. And so, it's also research also shows that this community significantly contributes to whatever environment they are in. We are I'm speaking very generally here, but LGBTQIA plus folks are typically very, very involved in their communities, and provide a lot of emotional labor to those around them. So just some interesting facts there about resilience and specifically this community in a rural setting. And so what I want to leave you with today is that equality for us, this is a great quote from Barbara Gettings, but equality means more than passing laws. The struggle is really won in the hearts and the minds of the community where it counts. And I love this quote because I found it to be absolutely true. Like I said, all 12 of the bills that have been proposed in Virginia have been defeated, thankfully. But there's still a lot of stigma. There is still a lot of bias. There's still, frankly, a lot of hate. Like I said, Lean In Project has been active for about 4 years now, and I would say on average we get at least a piece of hate mail per week. When I lived in Halifax, there were some times when I was afraid to let folks know where I lived because I wasn't certain that I was safe in my environment. And so that's a very real thing that is still happening today. We at the Lean In Project are getting a lot of, I think we started this thinking that we would get a lot of youth. And what we're finding is that there are also a lot of adults in our community who are really struggling and have lived in hiding or have existed, privately for a long time, but have never been able to fully express themselves or show up authentically as their full selves due to lack of support, and sometimes, extreme, again, predatory behavior, and really, a lot of hateful, both physical and verbal threats. And so what we're hoping to do, what we're trying to do, is just continue to be present in the space, continue to show up for folks in the community who need our support, and also work with other nonprofits and community partners to make, normalize this a bit, and to make sure that folks feel supported and have all of the resources they need to fully thrive as their authentic selves in our rural community. And so that's a little bit about us and what we do. Thank you all so much for listening today. And if you have any questions or comments, feel free to reach out to me directly. You can also check us out at www.leaninproject.org. I'll put that in the chat as well. We welcome any conversation. If you or your organization would like some capacity building or some training, we're happy to discuss that as well. So just let us know. But thank you all for your time, and happy Pride Month. Okay, Alex, I see. Yes, I will put my email in the chat as well.
Perfect. Thank you so much.
Sure
Thank you,
thing.
Liam.
Yeah. Oh, can't type. All right. So any questions before we head on with the next part of our agenda? All right. Hearing no questions.
I had
Oh,
one
sorry.
that I just put in the chat. Thank you, Liam.
sorry.
That was a great
Yeah.
presentation. Are you working with any local healthcare providers to conduct education to physicians, nurses, ER staff to help them just increase sensitivity and awareness, and help them with language, all of that?
We have tried and are certainly open to it. We have not had any healthcare providers take us up on our offer
Okay.
as of yet. But if you know anyone or have any connections, we'd absolutely love to be in that space.
Okay, thanks. We might be able to get you a larger audience. So
Great. Thank you.
okay. Mhm.
All right. Well, thank you all. Kenan, do you mind? Okay, thank you. Appreciate you. So the next update that we have for you all is just the update from our leadership team. I see we have National Night Out coming up. We're doing that in all 3 counties this year. Kenan, do you know the locations of where they're going to be this year? I don't have it off the top of my head. I'm sorry.
Sure, it's going to be August 6th, the first Tuesday of August of the first full week. It's going to be in 4 locations this year. Mecklenburg has 2 locations. So it's going to be in Halifax again at the fairgrounds. It's going to be in Brunswick County and Lawrenceville on Main Street. And then South Hill Police Department is hosting one in South Hill, and Chase City Police are hosting one in Chase City. So if we'd like, I can reserve us a table in all 4 locations if we want to be in all 4 locations.
Okay. We will put that out. I'll put that in my email this week.
Okay. And I know Sarah will be making us a flyer.
Perfect.
And doing a recruitment. If we want, we can do a recruitment Google Sheet.
Okay. Yeah, that would be great.
Okay. People sign up for the location that they want to help out.
Otherwise, we were not able to have our June leadership team meeting, and so we're going to get that rescheduled for July. But Catherine Maloney and I had the privilege of attending the CRI Community Resiliency. the CRI Pathways to Resilience conference in Roanoke for the last 2 days. This was a 2-day conference with folks all over the nation talking about the different factors of resilience and the different things that lead to folks needing to be resilient. Catherine, if you are able, would love for you to speak too. But personally, I really valued, I thought the sessions were great, but I think the keynote speaker yesterday was probably the highlight for me. It was Father John Abernathy. He is a priest from Pittsburgh, and he delivered a really moving and powerful keynote about some of the disparities that we see, but also, how when we talk about resilience and when we talk about ways that communities can grow and improve, we're also asking folks to kind of go against their community in order to develop these resiliency factors. And so I just thought it was very insightful and thought-provoking. But also, I think they said the 2025 conference was going to be in Walla Walla, Washington.
Wow.
So if we're going next year, we might want to start planning ahead for that. But Catherine, if you want to share anything.
Sure, this is Catherine. Hang on a sec. I'm gonna try and get my video. I got into the office. So yeah, I agree with Liam. Everything that we were exposed to over the last 2 days was enlightening for me, personally, professionally, and in the capacity of the Wellness Coalition, all three. Attended sessions that had a lot of valuable tools that I can take back to where I work. We can take back to the coalition. If we can get more people in person, even if we can't, that there's some things we can do that I think will facilitate where we want to go and how we want to get there. Father Abernathy was fantastic. I particularly enjoyed the first day keynote speaker. She was from Roanoke, Virginia. She's a national sportscaster for the NFL, and her story was quite honestly amazing and resilience at its finest. And what was her name again? Splitzer? Sisler, yes. And she was quite a storyteller, so she really knew how to tell a story really, really well. For anybody who would ever think about going to the conference, I think it's very beneficial, especially if you're in that space. So things we can bring back and work with the coalition on. So I'm excited. I was glad I went.
I agree. And we learned that our folks in Region 10, which if you're not familiar with the DBHDS regions, that's Charlottesville, are doing some super cool things with engaging youth in their area. And so I texted Kenan about borrowing some of those ideas and getting some of that brought to our coalition as well too, so that we can build our youth outreach.
Yeah, that session was really good too. And what I enjoyed about that session was they were getting at the kids' level instead of at our professional level or what we think works or doesn't work. They were engaging them and training them at their level, which, for a lot of us, TikTok and YouTube, it's not so great, but for them, it was a way to keep them engaged and make sure that they were learning and understanding how they were being trained. So I think it'll be good if we can use some of that to get more youth on board.
That would be awesome. That sounds fantastic. Please let me know who your contact or who was shared from Region 10 so I can reach out.
Okay. All right. So I think the next thing on the list is our ticket update, but I don't think Christine is able to join us.
I can share the book club. So
Okay.
Susanna is going to be hosting, that we announced on social media and in the newsletter. Next Thursday evening, starting for 5 weeks, Susanna Lomagno, who is also with Christine on the Ticken, she's hosting a book club at their location in Chase City, starting at 5 o'clock next Thursday and running for 5 weeks. As a trauma-informed care network, we did provide them with the books. We did provide them with a notebook, paper, a pencil and pen, as well as a copy of the curriculum that you can get at no cost online. Some suggestions for book club topics. And so Susanna has been recruiting folks, and it's been coming into me as well. She's expecting 5 to 7 people next week. But she does have open slots if anyone's interested.
Kenan, will this be available online? Because it's hard for me to get to Chase City by 5. Okay.
No, she's only hosting it in person. She's only hosting it in person. I do plan to reach out to her early in July and see how many people she has consistently coming, and looking, seeing if we can provide them a dinner one evening. Also want to share with you all that we are working on Suicide Prevention Month. Can I find it? Here we go. Hang on 1 second. So we've so far, where is it? Oh, maybe not. Oh, sorry about that. So far we have SVHEC in both Alberta and Keysville have agreed to host a lock and talk training on their campus, with whose flyer is escaped me now. I already made a flyer for this. It's not sharing. That we're gonna be hosting that. So we are looking for other partners in the area to host some of our suicide prevention classes during September. The Safe Talk, Lock and Talk, Applied Suicide Intervention Skills Training, Mental Health First Aid. If you know of anyone who would think that they would host one in their church, their school, their agency, we are specifically looking to see about hosting some trainings during the month of September. We already have 2 mental health first aid scheduled for PATH in July and August, and we have another mental health first aid scheduled at the hospital in South Hill in August as well. But we're looking for more opportunities to host more of the suicide prevention classes during the summer and through the end of September.
Mm.
And then also just to announce as well that the funding to have more coaching by face-to-face space for the leadership team as well as other members has been approved. So Paul Short, who is the CEO of Face-to-Face Space, will be reaching out to Liam as well as other members of the leadership team, as well as the Ticken, to talk about coaching with our capacity building through July all the way through December. I don't have a copy of that to share. And then the Secova Summit, as you all saw in the newsletter, the Secova Summit is going to be October 20th through 22nd. It's a 2-day conference. Right now, we have 5 folks from our coalition attending that. If you're interested in attending the Secova Summit, which is the Community Coalitions of Virginia Summit in Roanoke in October, please contact myself or Liam.
And I will say that if you work in multiple parts of the state Sakova is a really valuable conference. It's a great way to understand what all the different coalitions are doing, but also it gives you access to some of the folks from the DEA, from the Virginia Department of Behavioral Health, and so it's a really high touch opportunity for folks. Great networking and learning experiences. And so just wanted to plug that too for folks who may be interested. And thank you for sharing about Paul Kenan. I forgot to mention that in the leadership update.
No worries. And then also that we're moving forward with our application for the We Stand Together Second Summit in October. We are making application, following the steps through, applying for grant funds to support our second We Stand Together Summit, which will be in South Boston. So please be looking for announcements. Oh, go ahead.
Oh, just gonna say it'll be a 2-day event this year.
Do we have the dates for that yet?
The 11th and 12th of October. Also,
have you picked the location yet, Liam?
Yes, the 12th is confirmed at the Southern Virginia Higher Education Center, right there in downtown South Boston.
Okay. 11th, we're not sure of yet.
The 11th is either it's going to be in that general vicinity, but we're discussing with Factory Street, the Prizery, and Constitution Square.
Gotcha. Okay, thank you.
Of course. And then we'll be sending out sponsorship information in the next couple of weeks. And so if folks are interested in sponsoring or want a table at the events, we'll make sure to send that information out. But Alex, I did see in the chat, we will be sending out all the info by email.
Perfect. I don't think I can write fast enough.
Yeah. And I've added everybody on here will be added to our chip mail. So anything that we send out in terms of the newsletter, if you'll go ahead and follow us on the Southside Wellness Coalition, Facebook and Instagram, once all this information starts flowing out, it'll go through those 3 main avenues. Or if you want to email me directly at prevention@southsidebehavioralhealth.org at any time to ask questions about any of these projects, I can send it to you directly. And so sometimes I send too many emails, so I try to be respectful of what avenues I know you can take. But if you just want to email me, I'm happy with that. I have no issue with that. All right.
So I think we did Sakova, and so next up is our COC update.
All right, so Kenan, I'm about to text this to you, so you don't have to write it all down. So we got the final numbers for the point in time count on the evening of January 25th. There were 35 households and 76 individuals in Southside who were homeless according to HUD's definition. The COC was recently awarded $126,844 to administer the Virginia Homeless Solutions Program. For those who don't know, this is a program that we use primarily to assist with people who need emergency shelter, are in danger of becoming homeless, or for our rapid rehousing program. That's for people who are currently homeless. We're trying to get them back into housing as soon as possible. And we are still focused on options for a homeless shelter. We are currently exploring using FEMA trailers on land that Tri-County already owns. And this suggestion came to us from Dennis Damian, who I don't think is in the meeting today, but he gave me the suggestion the meeting before last. So we're very thankful for that kind of collaboration that allows us to get those kind of ideas popping around. And then our next meeting will be in person. It will be at our satellite office here at 900 John Randolph, and it will be on August the 9th at 10 a.m.
Does that have a hybrid option or no?
We're not sure yet, probably not, but hopefully.
Okay, right now I'll just put in person.
And you said that was the 9th, Elena, of August?
Yes.
Sherry, did you say you all provide housing just in Halifax, or is it just the region, Southside region?
It's for Halifax, Mecklenburg, Charlotte, and Brunswick counties.
Say that again, please.
I'm sorry, Halifax County,
Halifax, Brunswick.
Charlotte, and Mecklenburg.
Thank you.
You're welcome.
All right. Any other questions for Elena or the continuum of care? All right. Hearing no questions at this time, I'll open it up to you all for our general membership updates. So if you all have any member news you'd like to share or information you'd like us to get out, let us know, please.
Hi. I'm new, but if anyone is interested, on June 29th in Danville, Virginia, we're having a Latino community fair. It's open to everyone, but of course we have specific resources also for the Latino community. Apart from resources, they're also gonna have like, it's being hosted by a church and they're doing like a fundraiser for their kids' summer camp. So they're selling like Hispanic food. I think it's Central American food. So, if you are in the area on Saturday from 10 to 2, feel free to come in. I'll drop in the flyer in the chat box. Anyone's welcome.
Great, thank you.
Yes, yes, please drop that in the chat box so I can get that.
Any other member news or events you all have going on that you'd like us to share out?
Hey, this is Allison. I have one, of course, Suicide Prevention Month is September. So at the Central Virginia VA, we're going to be doing a resource fair. That's going to be on September 17th, 11 to 2 p.m. and it will be there in the hospital. I do know that it might be a hike for many of you all, but we're going to have organizations from, communities tabling. And so if anybody's interested in having a table, or even if they wanted me to pick up some information to kind of bring, to that event, I'd be happy to. And we're getting a flyer finalized, so I'll be able to distribute that to y'all once we get it all kind of signed off and everything.
Great, thank you. And then Allison, someone said, where is that? Could you provide a little bit more?
Sure, yeah, it's going to be at the VA hospital in Richmond, essentially. So the VA Medical Center, the address there is 1201 Broad Rock Boulevard. And I can put that in the chat too, if that's helpful.
Yes, please.
No problem.
Thank you.
I just popped in some information about our free membership offer at Girl Scouts Virginia Skyline to the end of July. And I'll probably have lots to share in the next meeting because I'm in the midst of planning for a back to school season right now.
And what are, Elizabeth, what are the ages where folks can sign up?
Great question. So girls going into kindergarten in August can already sign up, and Girl Scouts goes all the way through 12th grade for girls. And
Great, thank you.
that information, no matter where you live, but our free membership offer is just for Girl Scouts Virginia Skyline.
Great, thank you. Any other updates?
I guess I could share mine. I know I'll be presenting here in a few months, fully like you did today, Liam. But groups recover together. Like I said earlier, we're outpatient for those suffering with opiate use disorder. We have 12 locations across the state, but what makes us a little unique compared to everybody else is we have our own digital platform, so our own app. So we can serve anybody anywhere as long as you have service, data, Wi-Fi, etc. And we are a harm reduction styled program, so we're not going to kick somebody out for understanding that, everyday life does happen, things like that. So we, of course, like I said earlier, are utilizing a medication to go with that weekly group therapy. And like I said, I'll go into further detail, later on here in a couple months, but just wanted to make sure that that option is out there. If anybody has any questions, feel free to reach out.
Yes, and let me share that, and thinking about some of you having materials and resources to share. We are participating in National Night Out on those 4 locations. That's in Southside, a pretty well-attended annual event. So if anyone, as being a supporter and or member of the coalition, if you want to have materials on our tables for local folks to pick up, if you want to attend and be at the table at one of the 4 locations, but you want your materials at all 4 locations, even though you might not be physically there, we can do that for you. Whether you want to drop off the materials here in Clarksville or ship them to me, however you want to do that. If you want to have, and this applies to anyone, but I mentioned it specifically, obviously, since Alex brought it up, any information that our local folks can get access to, National Night Out is a great opportunity to do that.
Kenan, when is the first date of the National Night Out again?
It's August the 6th.
The 6th. Okay. So if we were to
6th.
ship something or drop it in, we'd need to have that here in the next couple of weeks for you.
Yes, I'll be, the folks who volunteer to set up at each location, I'll be delivering to them their materials on the 5th of August, that Monday afternoon, giving them a tablecloths, a tent. It's going to be hot, some waters, coolers, ice. And then I'll be bringing them all the materials that we as a coalition want to be set out as giveaways, brochures and other items that folks can pick up at those 4 county locations. And I would say that, we do have a lot of community events throughout the year in this area. That is really, really popular among healthcare providers, National Night Out.
Perfect. Thank you so much.
No problem.
All right, folks. Well, thank you all for sharing, your upcoming events and insights. Just a couple of training updates for you. We do have Revive coming up today at the Estes Center for the SVCC staff. We also have another Revive and Lock and Talk, both at SVCC at both SVCC campuses, in September. Again, the Secova Summit is coming up in Roanoke, October 20th through 21st. And the We Stand Together Summit is coming to us in South Boston, October 11th and 12th. So we will make sure to send out that information for folks. Again, if you have any flyers or things you'd like us to distribute, please send those to Kenan or myself. And otherwise, thank you all so much for your time today. Thank you to all the new folks who have joined us. We hope we'll see you again next month. And if you need anything in the meantime, feel free to reach out.
Thanks, everyone.
Thank y'all.
Thank you.
Thank you.
Thanks.
It said.
Oh, here we go.
Yeah.
You sure you want to stop the recording?